Hey everyone, I'm Masuma Khatun. Today I'm going to discuss and demonstrate about auscultation of heart. A stethoscope is used to auscultation for the heart sounds. The diaphragm of a stethoscope is used to identify high-pitched sounds, while the bell is used to identify low-pitched sounds. There are two normal heart sounds that should be allocated in auscultation, S1 for love and S2 for dub. So we need points of auscultation. There are 5 areas for listening the heart. We can easily remember these 5 points. All people enjoy Time magazine. So A for aortic, P for pulmonic, E for Erb's point, T for tricuspid, and lastly M for mitral. So here we can see in this picture, aortic point. We'll do auscultation in the second intercostal space at 1.5 centimeter to the right sternal margin. In the pulmonary point, we will do auscultation 1.5 centimeter to the second intercostal space at left sternal margin. In Erb's point, we'll do auscultation third intercostal space at left sternal margin. And in tricuspid point, we will do auscultation lower left sternal border fourth intercostal. And in the end, we will do the auscultation of mitral point, which left fifth intercostal, medial to the midclavicular line. So conclusion, first point, normal tone volume, physiological split, no additional noise. About second and third point, second tone was normal volume tone, no physiologically split, and I can't hear any extra noise. About fourth point, first tone was normal, physiologically no split, can't hear any extra noise. About fifth point, no additional tone. So conclusion of this patients is rhythm of tone was correct, heart rate was 66 per minute, and this patient is completely normal and healthy. So thank you so much.